All right. So
Done.
the first thing I'm going to do, I want to test out a new poll. And there is a question, well, there should be a question up, and it is saying, how many smokers are there across the world? And you've got a choice there. If you can just click on whichever you think is the correct answer. Can you see it, Shanaz?
Yes, I've completed the quiz. It should be popping up for everyone who's joining the meeting as you join the meeting. Just raise
Okay,
your hand if you're
fantastic.
having any issues and we can help you.
So you just click on the answer. It is either 25 million, 100 million, half a billion, or 1.25 billion. It hasn't popped up for you, PJ. Okay,
We started
let
in
me,
delivery until by 2009.
Jackie, I think relaunch the poll.
yep, okay, will do. What I'll do is I will start sharing my screen and then I'll try and launch it again. All right, so we're going to start. Let me pop my camera off. Share my screen. Okay, so as I've already indicated, welcome to our CPD session tonight. We will be done by 8 o'clock, so I won't be keeping you for long. Just to give you an overview, the executive summary. So we all know that smoking is the leading cause of preventable diseases globally. We also know that medical schemes lack a structured smoking cessation benefit. Pharmacists can play a crucial role in smoking cessation interventions. And our proposal, which we are lobbying at different levels, is to introduce an evidence-based stop smoking service, which is pharmacist-led. This aligns with NHI and the Call for Preventative Healthcare. Below, you'll see a ribbon with medical aids. Those are the medical aids currently that do have a smoking cessation benefit. And what we are doing, we are speaking to them to get the ICPA smoking cessation service approved. We are at the same time speaking to Council for Medical Schemes to basically all dependence addictions are actually a PMB. And so we're trying to say to CMS to declare smoking cessation PMB service. We've had a couple of meetings with them and that is going well. Let me at this stage see if I can relaunch that poll. Hopefully it's on your screen now. And then you can just click on whichever you think is the correct answer. So what do you estimate are the number of smokers there are across the world? Is it visible to you now, Mebub? Rakesh?
No, this doesn't come up as yet.
Not visible.
That's funny. Okay, not a problem. It was something new we were trying, so I'm not sure why it's not coming up, but anyway. All right, let's move swiftly on. So the global burden of tobacco use. It's estimated at the moment that there are 1.25 billion users of tobacco worldwide, and 80% of those smokers are in low to middle income countries such as our own. This contributes to over 7 million deaths annually. It's a huge number. And 1.3 million deaths from secondhand smoking. Sorry, I'm just going to mute. As you come in, if I can just ask people to mute. 1.3 million deaths from secondhand smoke. The interesting thing is that over 60% of smokers want to quit, but 70% of them have absolutely no access to any form of stop smoking support. The impact of smoking on non-communicable diseases is we know that it is a major risk factor for non-communicable diseases. And 14% of all NCD-related deaths of adults aged 30 years and over are actually attributable to tobacco use. So tobacco in any form is deadly. And smoked tobacco products, including water pipes, contain over 7,000 chemicals, including at least 250 chemicals known to be toxic or to cause cancer. Lifelong smokers lose at least 10 years of life on average. And tobacco use or exposure to tobacco smoking affects almost all organs of the human body and has a negative impact on health across the life course. Although tobacco products are usually associated with NCDs, such as cancers, heart and respiratory diseases, tobacco is also an important factor in deaths from communicable diseases. For example, TB, which can be latent or dormant until activated by tobacco use. So tobacco cessation significantly reduces the risk of various diseases, and those mainly NCDs. So what is our role as pharmacists? Well, the GPP requirements are that a pharmacist's first concern must be the welfare of the patient and of the public in general. So there is a ratio that can be used. This is called the NNT, or the number needed to treat. And this is defined as the number of people who must be treated for a given period to prevent a specified event. So if we look at the relative effectiveness of different health interventions, we can look at, for instance, statins. Now, you'll know statins, they are a PMB condition. So statins have got an NNT of 60 for heart attack and 268 for stroke over 5 years. In other words, you have to treat 268 people over 5 years to prevent one stroke. If we look at NNS, which is number needed to screen, and we look at something like cervical cancer screening, which also is a benefit that medical schemes cover, the NNS to prevent cervical cancer is 1,140 to prevent cancer over 10 years. Sorry, I'm just clearing the drawing on the screen. Now, if we look at smoking cessation, so an intervention called brief advice. There, you need to give brief advice to 80 smokers to prevent one premature death. If you take that brief advice and you add pharmacological support, such as NRT, then you need to actually treat 38 to 56 to prevent one death. Add behavioral support to that, and the number drops to 16. And if you actually help 2 people to stop smoking, you will have saved 1 life. So certainly, in terms of relative effectiveness, smoking cessation is definitely something that we need to look at. So our role is to save lives. 1 premature death will have been avoided with every 2 smokers a pharmacist persuades and helps to stop smoking. So I'd like to show you the benefits of smoking cessation. And I'm hoping that you're going to be able to hear this. Can you hear it, Shanaz?
Not yet. Oh, it's very, very soft.
Oh, okay, let me turn it up.
Yeah.
Can you hear that now?
No, sorry. No,
Okay. Now, remember last time we managed to work out how to
I think close it
do
if you can and open it again.
and switch to, is it is it the speakers? It's not the speakers, is it?
No,
Can you remember where it was, Shanaz?
we just opened it again and it suddenly worked like magic.
Oh, did it?
Yeah.
All right, let me just see.
Sorry, guys.
Audio settings. I'm just going to have a look here. Output. Okay, my volume is on maximum. Let's try again. Yet?
Not yet. No. PJ is saying on the video on the right-hand side is the volume toggle, video volume toggle. Okay, so in the bar where you've got a pause,
Yes.
to the right-hand side of that, there's a little, you see that speaker? Right, but it's all the way up.
Still not.
Nope, nothing. Sorry. I think our other option was to play it from the web, but that was a difficult find.
All right. What I'll do is I'll just talk you through it. So I'm just going to start it again. Apologies for this. I will send the video link to everybody. So basically, the longer you smoke, the worse it is for your body. But what you may not know is that as soon as you quit, there is a difference. And in fact, within 20 minutes, your breathing becomes easier and the temperature of your hands and feet return to normal. After 8 hours, the nicotine reduces to 93.25%. And after 12 hours, your oxygen levels return to normal and your carbon monoxide levels halve. After 24 hours, your anxiety levels reach their maximum. And after 48 hours, you start to smell better. And your sense of smell returns to normal. After 72 hours, you are 100% nicotine free. The bronchial tubes in your lungs relax and you can breathe easy. At 5 to 8 days, you are having 3 cue-induced cravings for smoking each day, and it only lasts 2 minutes. After 2 weeks, the blood circulation is similar to that of a non-smoker. And there, after 2 to 4 weeks, a lot of the withdrawal effects are dropping. Right, let's get straight into StopTober. So October is StopTober, and StopTober is your time to quit smoking. And this is what we're going to be sending out to the public. So StopTober is a 28-day smoke-free challenge. So we challenge people to choose a day in the first week of October and to then not smoke for 28 days. Now, quitting smoking is one of the single most important steps that you can take to improve your health. And just 28 days smoke-free means you're 5 times more likely to quit for good. So the call to action is whether you've tried before or whether this is your first attempt, StopTober is the perfect time to start. With the right support, quitting is possible. And your local ICPA pharmacy is here to help. Right. So what are the objectives of the campaign? So it is to challenge all South Africans who smoke to quit for 28 days during October. It is to alert smokers to the benefits of stop smoking. It's to ask clients about their smoking status during October. Ask everybody that you come across. When you take a medication history, when you're doing OTC or counseling, ask people whether they smoke or not. Highlight the link between tobacco use and heart disease and promote the role of the pharmacist in smoking cessation. So as ICPA pharmacies, an info flash will be going out tomorrow, and it's going to have a number of things in it. One will be, there will be smoking cessation posters, which you can print and display in your pharmacy. Secondly, ask your patients their smoking status when dispensing a prescription, counseling, or advising on OTC medicines. Assess their readiness to quit using the readiness assessment tool, and this will be sent to you. If you consider them ready to quit, assess their nicotine dependence using the Fagerstrom nicotine dependence test, and this will also be sent to you. Get the patients to download the free smoking cost calculator, and we will send that to you. You can pop it onto your website as well. Recommend the free Quit Tracker, which is a stop smoking app available in the iStore and in through Android, through Google Play, to track progress. You can apply the WHO cognitive and behavioral interventions for patients experiencing nicotine withdrawal, and we will send these to you. And set up a Pharmacists Against Tobacco display in your pharmacy. Lastly, make a tar jar, and we'll give you the recipe for this. It's a very good motivational tool when people see what smoking does to your lungs. So here's the first one. And these are just some of the examples of the posters that we will be distributing. So print them and display them in your pharmacy. And here it's quite simple. You can quit with help. Ask your pharmacist. And we'll be using the Love You to Stop Smoking. You'll see the logo in the top right-hand side. And that is the logo on our Facebook and our socials as well. The next thing I said was to assess the readiness of smokers to attempt to stop smoking. Now you'll see there's a graph on the right-hand side, and you ask your patients their smoking status as part of your history taking to identify your smokers. To check whether they are motivated to stop smoking, ask on a scale of 1 to 5, where 1 is not motivated and 5 is very motivated, how motivated they are to stop smoking right now. So here you can see 1 to 5 on the x-axis. On the y-axis, it is a measure of their confidence. So to check whether they are confident in their ability to stop smoking, ask on a scale of 1 to 5, where 1 is not confident at all and 5 is very confident. How confident are you that you could stop smoking right now? And then obviously you plot it. If they had a 4 as far as motivation went, and they had a 3 with confidence, you'll see that they're in the green. And to assess that, you then have a look at the table, and the table shows you the green is this smoker is ready to stop smoking. Suggest they set a quit date. The next one is the light green. These are good candidates. You need to boost their self-belief and motivation and provide additional information on the benefits of stopping smoking. The yellow, they're not immediately ready, but they may be a candidate. So put it onto their profile that they are smokers and ask them again the next time they come in. And then red, you are going to have some that are just not ready or not willing to make a commitment to stop smoking. Maybe give them a pamphlet on the benefits and leave them to it. Those that want to stop smoking should be assessed for their nicotine dependence so that the right medicine, if any, can be recommended. This is the Fagerstrom test for nicotine dependency, and this will be sent in the info flash. It's 6 questions, and you can see them there on the right. The first one asks about how soon after you wake up you have your first cigarette, and you'll see that there's different scores. So depending on their answer, they will get a score. The next one is, do you find it difficult to refrain from smoking in places where it's forbidden? The next one is, which cigarette would you hate most to give up? The fourth question is around how many cigarettes you smoke a day. Number 5 asks whether you smoke more frequently during the first few hours of the day than that of the rest of the day. And then the last one is, do you smoke even though you are so ill that you're in bed most of the day? You then take the score that they get for each question, and it'll come to a grand total. And then you'll see, depending on that total, they will fall into one of these bars. Now, most people fall between 2 and 5, 2 to 3 being average. And folks, if you're going to get somebody who's 8 to 10, those people are extremely addicted to nicotine, and it is going to be a real challenge. You'll have to throw everything at them if they want to smoke. But very often you'll find those people at that extreme do not want to stop smoking. So do a nicotine dependency. And what this will do is, for instance, if they're in the average to above average, they are dependent on nicotine and they will experience some withdrawal. And the higher the dependence on nicotine, the more they are going to require pharmacological support, such as NRT or varenicline. The next thing you should do is to talk about the financial benefits. So there is a savings calculator, and we will be sending you, it's a little widget. You can put it on your website, but you can even just do it on the back of a cigarette box. A savings calculator. For instance, if a pack of cigarettes costs 27 Rand and you smoke 20 a day, you're going to be spending 54 Rand every day. And you can see that over a year, that comes to about 20,000 Rand. And over 10 years, 200,000 Rand. So one of the things you do in the StopTober is you say to people, what are you going to do with the money that you save? And this can be quite a good motivator for people. The WHO cognitive behavioral therapies, because behavior change is very important whenever you've got an addiction, are dealing with the withdrawal symptoms. And there's a number of them, but the one that I always like to use when I'm doing smoking cessation as a service are around the cravings. And it's the 4 Ds, a strategy to deal with smoking cravings. You'll remember in the benefits, it said that you're going to have about 3 smoking urges to smoke 3 times a day, and it's not going to last longer than 1 to 2 minutes. So you need to do something to distract yourself for 1 to 2 minutes 3 times a day. And the 4 Ds are delay, deep breathing, drink water, or do something else to distract yourself. And this is the basis of behavior change therapy. I spoke about the tar jar. This recipe will be sent to you. Kenview have also given us a large number of tar jars, which we will be bringing to conference. We have got them at the office, but they're difficult to courier and was worried they're going to break open. So you can make it yourself. You can see the recipe there. And the tar jar graphically represents the amount of tar in tobacco smoke and helps to explain to smokers what causes cancer, bronchitis, and emphysema. It's this tar. This is the carcinogens are in there. And the average 15 to 20 a day smoker takes about a mugful of this brown sticky tar into their lungs every year. The sight of the smoker's tar jar has been enough to motivate smokers to stop, and it's an excellent visual aid. So, what else can ICPA pharmacists do to get ready? We will be sending a link for the NCSCT open source training. This is based in the UK, where the NHS recommends pharmacists for smoking cessation as smoking cessation practitioners. It's open source training, and it's something that you can do yourself. It's online, and you actually do get a certificate at the end. There will be a media release going out, and we will be sending that to you as well in the info flash. Distribute that ICPA media release. Put it on your LinkedIn. Put it in your newsletter. Send it out. And of course, promote the role of the pharmacist as a smoking cessation advisor. All nicotine replacement therapy products state in the package insert that success depends on the NRT forming part of a formal smoking cessation program, or at least involving some follow-up or guidance. So recommend NRT to assist with nicotine withdrawal. All of the NRT products are Schedule 1 and Schedule 0, so they are available as pharmacist-initiated therapy. Is smoking cessation within the pharmacist's scope of practice? You might ask that question. And in fact, Council for Medical Schemes asked us that question. Well, all you need to do is go to the good old GPP, Rule 2.16.2, smoking cessation, the minimum standard. And it says, pharmacists should advise patients to stop smoking and give patients information regarding pharmaceutical products that can assist them with this process. The following standards must be followed where a pharmacist is participating in anti-smoking campaigns. A, the pharmacy must have written information on how to stop or reduce smoking. Now, there you're going to have the patient information leaflets in your NRT. The pharmacist involved in assisting patients in smoking cessation must have up-to-date knowledge base on the optimum ways of stopping smoking and should be able to advise on the products sold with an invitation to come back and report on progress. Supporting information must be readily available. Counseling sessions to stop smoking must be available from the pharmacist by appointment, or a suitable system must exist for referral. And F, smoking must not be permitted in the pharmacy. So what is a brief intervention? A lot of people say we just do not have time. Well, a brief intervention is exactly that. It's brief advice. It takes a few seconds or a few minutes during a routine interaction, and this should be given to all tobacco users. Brief tobacco interventions in clinical settings are feasible, effective, and efficient, and can have a significant population impact if they are delivered routinely and widely across the healthcare system. So, very brief advice, the 3 A's: ask and record tobacco status, advise on the most effective way of quitting, and act on the patient's response. This is a 30-second intervention, and this can be 30 seconds to save a life. I did have a video, but since my sound seems to be giving problems, I'm going to skip over this. Oops, sorry. So, StopTober. In our media release, we are talking about StopTober. Go into your pharmacy. Your pharmacist will help you. There is an 8-step plan. Step 1. Set a quit date. Step 2, plan what to do with your savings. Remember the cost calculator. Step 3, focus on your reasons for wanting to quit. And everybody has a reason for wanting to quit. And it can be anything from being a role model for children or grandchildren to wanting better health, to saving money. Step 4, identify and manage triggers. So there are going to be triggers, and these are things that you associate with smoking. So for some people, going out with your friends in the evening could be a trigger. Going to the pub. It could even be going at tea breaks, going outside and joining the other smokers. So you identify these and then you avoid them. Step 5, decide on medicine to manage withdrawal symptoms. And here, remember, NRT is within our scope of practice. And I'm going to show you how effective it is just now. Step 6, build a support network. Now, that support could be the pharmacists. In other words, they come back and they report to you once a week. It could also be a family member, a loved one, or somebody else that has given up, a buddy. Step 7, learn healthier ways to manage your triggers. So if, for instance, one of your triggers was going to the pub, then rather go for a walk. But they must choose those, make them part of that decision-making process. And then step 8 is repeat and stick to the plan. So if we look at step 5, pharmacotherapy, I'm just going to take you quickly through here. I'm not going to dwell on this for very long, but we know there are 3 types of smoking cessation medication, and that's NRT, varenicline, and bupropion. If we look at the relative effectiveness of the different treatment options at 4 weeks post-quit, this is from a Cochrane review, you can see that with no medication, people that try and quit with no support are only 16% of them will manage to reach 4 weeks, the 28 days. So another, 84 are not going to make 28 days. They're just not going to reach there. If you go to mono NRT, so that's just one of the nicotine replacement therapy medicines, you can see it increases slightly. But if you add support, it starts going up very nicely. So a third are effective. Now look at combination NRT. Now you're starting to see that there is a big increase in the number of people that will reach 4 weeks post-quit. You can see bupropion, but that is, I believe the Zyban is not made in South Africa. Well, it's not sold in South Africa anymore, and it wasn't one that we routinely recommend anyway. And then you see the varenicline is very much on a par with combination NRT. Now, of course, varenicline requires a doctor's prescription, and it would mean referring. And there may be some people that just do not want to use NRT, and then you refer them to a doctor and get a prescription for varenicline. But the majority can be managed on NRT alone. Now, if we look at NRT, why is it that combination nicotine replacement therapy is so effective? Well, let's have a look at what a cigarette does. So on the y-axis, this is plasma nicotine. And then on the x-axis, we've got time. So if you're starting at 0 with a cigarette, which is the solid line, so you can see the solid line going up there. You can see within 2 to 3 minutes, the nicotine is in your bloodstream. It's already hit your receptors in your brain, and it peaks at about 8 minutes. And then there's quite a rapid decline. So within 10 minutes, you've already dropped down, and you can see within an hour, you're down to a fairly low level, which is why those that are very addicted to nicotine are probably going to need to light up another cigarette. Now, if you put a patch on, you can see at 0, you're putting a patch on. Look how slowly the nicotine goes up. If you look at a spray, you can see a spray mimics a cigarette more closely. So you get a quick peak, and then it starts to drop off. If you look at gum, you'll see there it's a slower incline, and then it also plateaus off. So when you combine something like a patch, which is going to give you nicotine over about 15, 16, 17 hours continuous, when you get those urges to smoke, you can quickly use a spray, and you can see there, it's going to give you that very quick nicotine increase there. Or you could chew a piece of gum. So that's why the combination works so well. So what is the NRT that is available to us? We've got the nicotine patches. They're available in 3 strengths, 25, 15, and 10. It lasts up to 16 hours. It's a once-a-day solution, and it provides a steady dose of nicotine to help control cravings over 16 hours. Which strength should be used? And it is a 12-week program, guys. You need to say to people that are serious about stopping smoking, they need to commit to 12 weeks. That's 3 months treatment. And there you can see your heavy smokers, which are 10 or more cigarettes a day, you're going to be starting on the 25 milligram for 8 weeks, then 2 weeks on the 15 milligram, and 2 weeks on the 10 milligram. And they need to commit to that program. And they also need to commit to the not a puff rule. Your medium to light smokers who will be less addicted to nicotine, you can start them on the 15 milligram for 8 weeks and then the 10 milligram for 4 weeks. It is still a 12-week program. Common side effects. Some people get a bit of skin reaction to the plaster, a slight burning sensation. Some people find that they are quite wakeful and that they have vivid dreams. And so a tip here is if the treatment disrupts sleep, remove the patch a few hours before bedtime and control any cravings with the gum or spray. Obviously, patients with psoriasis, eczema, or very sensitive skin use a different product. The gum, which strength should I use? Here again, it starts to work from the first chew. It's available in 2 strengths, 2 milligram and 4 milligram. If you smoke 20 cigarettes per day or less, you can use the 2 milligram gum, but you are going to be using about 15 gums a day. If you're smoking more than 20 cigarettes a day, or if you find that the 2 milligram is not controlling the desire to smoke, then use the 4 milligram. And again, you're looking at 15 gums a day, and you are probably, to be effective, going to be using it for 2 to 3 months. That is very important. This would be if you were using the gum on its own. Obviously, if you're using the patches, you would just use the gum when you get those urges to smoke. So it would be a lot less. Oh, sorry. Apologies for that. I closed it instead of, let me just bring it up again. Okay, the correct use. We talk about chewing the gum, but it is not a chewing gum. The correct use involves a chew and park technique. So you chew the gum very slowly until there is a strong nicotine taste. Then park the gum in between the cheek and teeth to allow the nicotine to be absorbed through the lining of the cheek. The idea is that you do not want to be swallowing the nicotine. This is when you start getting horrible feeling in your throat. You start burping. You can feel nauseous. If any of that happens, it's because they are chewing and swallowing the nicotine. You actually want the nicotine to be absorbed through the lining of the cheek. You then wait for the nicotine taste to fade, and then you can chew it once or twice again. Chewing too much will result in excessive nicotine release. and then it'll be swallowed with saliva, causing the side effects that a lot of people complain about with the gum. So technique is important. Common side effects could be a tingling or burning in the mouth, indigestion, hiccups, jaw ache. Top tip, people with dentures should use a different product and avoid it if you have gastric ulcers, esophagitis, or gastritis. Lastly, the nicotine mouth spray. So the mouth spray, you saw on that nice graph how quickly and how effective it is. If you're going to use the mouth spray on its own, step 1 would be for weeks 1 to 6. And you would use 1 to 2 sprays. I'm not going to go into detail here because it's in the package insert. But again, you are looking at 12 weeks treatment. That's if you're using the spray on their own. Our recommendation is combination therapy, where you use the patches and then you supplement with probably the mouth spray would be the most effective, or the gum. Side effects of the mouth spray: hiccups, distortions of taste, headache, indigestion, nausea. These side effects become less severe with continued use. Contraindications of NRT are those with any hypersensitivity to any component of the NRT product. Children under the age of 12, we probably wouldn't recommend it under the age of 14, since anybody under 14, you would need a parent's consent in any case to recommend that medicine. And at the moment in South Africa, it is contraindicated in pregnancy and breastfeeding. So if you have a pregnant mum, we definitely want them to stop smoking, but I would suggest that you refer them to their obstetrician and get a prescription for the NRT, as it would be a contraindication according to the package insert. So let's just quickly bust a few myths around NRT. So many people will say using NRT products, you're just replacing one addiction with another. Well, this is not the case. You're going from thousands of chemicals down to one. The nicotine in any of the NRTs is much less than that in a cigarette. It's a slower release. And the idea is that it is a short-term use in order to come completely off it. And you are more than twice as likely to quit successfully with NRT. I only need to use my NRT when I get a craving. If used alone, NRT products should be used throughout the day, and you should not wait for the craving to come. It should be used as a preventative and not a cure. Nicotine causes the same diseases as smoking. That's not true. It's not the nicotine in cigarettes that causes cancer. It's the hydrocarbons, the tar, and the other chemicals that make smoking so dangerous. And nicotine is only one chemical compared to the thousands in cigarette smoke. Top tip: be careful not to underdose smokers with the 2 milligram gum. The 4 milligram will be more likely to keep cravings at bay. And then the last myth: I chew Nicorettes like regular gum. No. For nicotine to be absorbed, you need to chew and park. And here's another top tip: don't drink an acidic drink like juice or coffee 15 minutes before using oral nicotine products, as it stops the nicotine from being absorbed. So NRT. Some smokers do not feel able to stop using NRT at the end of a prescribed course for fear of returning to smoking. And you're going to have these. You're going to have some people who end up on NRT for the rest of their lives. It is the lesser of the two evils. It's what we would call harm reduction. But some long-term NRT users experience mild withdrawal symptoms when they stop using it. And NRT has not been associated with any serious events, adverse events. So NRT, the effect of NRT appears to be additive to the effect of behavioral support. So combination NRT combined with behavioral support is more effective than either alone. Some say using nicotine patches a couple of weeks prior to your quit date increases long-term abstinence rates. And we already know that combining different forms of NRT, for instance, the patch and gum or the patch and spray, increases quit rates by up to 27%. Guys, the last thing I want to tell you about is the actual ICPA Stop Smoking service. So this is not the very brief intervention, the 3 A's. It's a full stop smoking service over 6 weeks, and it combines behavioral support, counseling sessions, pharmacotherapy, and monitoring and support. And this is the most effective smoking cessation service. It's used in many countries, which is pharmacist-led. The NHS is one of them, and our training is based on that. Now, we've trained our first few pharmacists. I think we had 40 that have already finished the training, and we're hoping to do another training soon. So if you haven't already done that, please take part in the StopTober campaign, and this will set you up in the future for being able to provide the full smoking cessation service. And remember, we can nurture the profession, expand the role of pharmacists to the very limits of their competence, and share in the obligations and responsibilities and serve society. That was Andy Gray in FIP 2017. Thank you very much. So at this point, guys, I'm going to ask if there are any questions, and I'm just going to check the chat. And I think, Shanaz, the info flash, when will that go out with all of the stuff that we spoke about?
Good evening. It'll go out tomorrow.
Oh, super. All right. So that would be posters. It'll be the Fagostrum test, everything that you need. The recipe for the tar jar. One of the questions I wanted to ask everybody is there anybody who is not confident about prescribing or recommending NRT? Because if so, we can get Kenview to send a rep out and to assist, or maybe we can have another CPD just on NRT. We're all confident. I mean, it's not rocket science. I think it is basically get the package insert out. Kenview also have very nice smokers' diaries or smoking cessation diaries. And we've got a lot of those at the office. So if there's anybody that would like some of those, we can send those around too. Or alternatively, we can ask Kenview to drop them off at you. I see Meeboop thinks it'll be a good idea to have a CPD on the NRT. We can do that. Oh, it's wonderful. Thank you, Patricia. Very glad. Please implement StopTober. We will be sending out the media release, so hopefully it'll get picked up by the radio stations and maybe even the TV. And then we can really say to people, find an ICPA pharmacy and go and stop smoking and live your best life. Yeah, I see Meeboop, you also saying that the reps could visit those on the call. We can do that. I see Tracy, thank you. You've been collecting email addresses and names for people that would like a CPD certificate. And if there's anything else that you need, please just email info@icpa.co.za and we will get that to you. Oh, I see Rakesh has lost power. All right. Any other questions? Oh, fantastic, Michelle. I'm so glad to hear that. And this has been recorded. We made sure this time Shanaz is recorded and hopefully I have, so we can also send a recording out at a later stage. But guys, I'll be very proud of you if you all join the StopTober campaign. We're going to be pushing hard in terms of the media. And then, as I say, we are also talking to Pharmacy Council. We are talking to Council for Medical Schemes. And we hope in the future to have this a paid for service done by pharmacists to help people stop smoking. Thanks, everybody.
Thank
Oh,
you.
I see Gabo is on here. Gabo, don't you want to say good? Oh, Lily, before Gabo says goodbye, Lily. If you just unmute Lily in your bottom left-hand corner. And if you can't unmute, you can always type it in the chat. Okay, I think Lily's struggling a little bit there. Gabo, would you mind closing off for us?
Sorry, Jackie, one moment just before that. If everyone could please, if you would like a CPD certificate, just put your name and your pharmacy in your email address, if anyone hasn't done so as yet. Thank you. Please go ahead. Sorry about that.
Thanks, Shanaz.
Thanks, Shanaz. Good evening, colleagues. Thank you so much, Jackie, for the webinar. Very informative as always. I believe StopTober will be a successful month for the smoking gang that we want to stop smoking. And I think a CPD, as the chair recommended, will be good. I think it will go a long way just to clarify any gray areas. But I think we are indeed fairly confident to be able to implement in the coming month. But let me thank those that have managed to set time aside to be with us tonight, and you at the office, Jackie, for the continuous hard work. And they mentioned that the CMS and SAPC were busy engaging them to ensure that ultimately we can get this program paid by the schemes as a PMB. I think that is a very, very good initiative and good work from the office side. So thank you for that. And I do know that the chair is with us here, Jackie. Perhaps the chair want to just summarize quickly and release all of us. But thank you very much for a well-presented webinar, Madam CEO. Really appreciate it. Mr. Chair, please come through. I'm sure you have arrived now.
Thanks, Gabo. Yes, oh no, he says reception is poor. All right, so our
Okay,
our
that's
chair
fine.
was joining via his phone.
Yeah.
He's not just a pharmacist, he's a farmer too. So he's out in the farmlands. All
He's
right,
a farmer
everybody.
and he's a farmer and a farmerpreneur.
Absolutely.
Thank you so much, guys. Please keep
Thanks,
well until we
everybody.
meet again. Thank you so much. Good evening.
Good evening. Bye-bye.
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 Bye.
Jackie, just keep
Shanaz?
stay on with me, please.
Yeah, I'm
Thanks.
going to stay on with you. I'm just going to see why this poll wasn't working.
We can
But
try.
you could see it. Can
I
you
could-
see it now?
No. I saw it when I logged on. I think there was Aisha Popat, who was one of the first online. I wonder if she saw it. And then it suddenly disappeared. It's very odd. So,
Oh, I see it says poll ended.
right. So I think when I took it, it may have only required one
Yes.
participant to actually participate in the poll. So I took it submitted. Yeah, there we go. There it's back up.
There we go. Okay, that's
That
what I did
relaunched.
wrong.
It relaunched the
Yes.
poll, hey? Yeah, okay.
I needed to do a relaunch. All right.
Yeah.
And then I'm just going to, let me just try again with that video and see where that sound is. Let me just go back to the video
Give me
because
1
I
second.
must.
I'm going to stop the recording now.